And we're going to be going over some different types of medication packaging. So with the medication, the forms often kind of allude to the packaging, or they kind of go hand in hand. So if it's liquid, of course it's going to be something that'll hold the liquid, so on, so on. But they kind of give themselves to how they're going to be administered as well. So like a lotion, you're not going to administer a lotion IV. That just doesn't make sense. Most of the ones that we're going to be using in the paramedic level are going to be your liquid or solid forms or inhalants. You occasionally might use a spray, but most of the time that's going to be most of the ones that you will see. Now it is important to know the different types of packaging so that you know how to open them and access them appropriately. An ampule is typically a single dose, but always double check. Two of the more common medications that you will find in ampules will be fentanyl and epinephrine 1 to 1,000. That doesn't mean you might not see other things. In the picture there you see adrenaline, epinephrine, both the generic and trade name, but also you see Narcan. So you don't see Narcan very often. Notice the colored line around the top. You want to make sure that you give it a couple of little light thumps to make sure that all the volume, all the liquid is below that line. And there's a scored line there around that neck. So what you're going to do is you take your little alcohol prep or a little folded over 4x4, and you're going to wrap it around that point and firmly snap the top of it towards yourself and opening it away from yourself. It is glass, so it can cut you, so be careful. You also want to use a filtered needle. The likelihood of getting glass down in there is very small, but nonetheless there is still a risk. So make sure you use a filtered needle to draw out of a glass ampule and dispose of it in a sharps container when you are done. A pre-filled syringe, there's a couple of different types, but they're going to be about the same. You'll have it may be assembled, it may be unassembled, but you're going to take the caps off. Okay, the yellow caps in this case. Then you're going to insert and kind of twist it together. And then you want to dispel any air and make sure that you are ready to give it. And you can see the measurements there where you would mark out how much you are giving. They're usually going to be color-coded and they're usually packaged in common doses, but not always, so always verify. Now, you have two different ways of administering on this particular one in the picture. You've got the green cap part, which you just unscrew the yellow, and then you can administer it through a Luer lock. Or if you remove the entire green portion, there's a needle underneath, so you could add it to a saline bag or deliver it through a non-Luer lock administration port. Your Tubex syringes are a lot of times used for your controlled substances, and you have to have this adapter. Now there's two different major types of adapters, the ones like here seen in the picture where it kind of screws onto the end plate and then the barrel lock goes up and over it to lock into place. And there's another one where it has a whole long terminal tube part where the whole thing snaps in there. A couple important things to note on here. Number one, you do not administer air if you're drawing out of it. Okay, you will blow the end out of it. It's just a rubber stopper. The other part, where it connects in on the very top of the syringe there, a lot of times that has to actually be snapped down before you can administer at the Luer lock or through the needle. So make sure that it's snapped into place. I call it the thingamabob. I've never been able to remember Tubex, but whether you call it a Tubex or a thingamabob, just remember that you've got everything connected properly or it will not administer. In a pinch, if you take off the end piece, there is a rubber access point there under it that you can actually insert a needle and withdraw the medication should you need to, like a single dose vial. Now with your single dose and your multi-dose vials, these are common. They're probably the most common ones you'll see, and they usually contain a standard dose, but it can vary based on manufacturer, so it depends. I've seen, for instance, ketamine. I've seen it 10 to 50 milligrams in a container, and I've seen it 500 milligrams in a container. So it really just varies based on what they can get. All right. With your multi-dose vials, these have a self-sealing rubber tip and top, and what these are is it allows for multiple punctures, so that way you can continue to use it. You must use sterile access if you're going to use these so that you don't contaminate. You must cleanse the top before you administer or push in a needle to withdraw medication so you don't contaminate the rest of the medication. Also, a good kind of rule of thumb is if you open a multi-dose vial, I usually take a little piece of tape, a little silk tape or something, and write the date on it when it was opened, because sometimes they may have an expiration date that they may only be good for a month after opened or something of that nature. So find out whatever your agency requires and go from there.